Welcome back here. As you know, February is National Heart Health Month, and according to the World Health Organization, cardiovascular disease, the world's #1 cause of death. Recent studies show there's evidence of links between your oral health, yes, your teeth, and heart disease. So here to talk about this, we have co-founder and CEO of the Super Dentist, Kami Haas, joining us. Good morning, doctor.
Good morning. How are you? Good to see you again.
I'm glad to see you. And we're talking about teeth and your heart. I didn't realize there was even a connection.
Yeah. You think what's going on up here, how does that impact our heart, right? By the way, it's not just the heart. Oral health impacts almost every organ in the body, you know, from pregnancy health to heart disease to cardiovascular disease to Alzheimer's, many. But this month is not only the National Heart Health Month, but it's also the National Oral Health Month, Children's Oral Health Month. And I think that's not a coincidence because they're related. So how are they related? Well, the oral health, your mouth is filled with microbes, right? Somewhere between 5 to 100 billion microbes.
Wow.
So
in here?
Yeah, it's right up there. Depending on the oral hygiene, you know, between 5 to 100. So what happens? If you have poor oral hygiene, your gums may bleed, right? You may have some cavities, and then the microbes can get in the blood. Where does the blood go? Everywhere. So it can cause either inflammation of the blood vessels and narrowing of it. You know, the endothelial cells in the blood can get narrow, and that can increase blood pressure, can increase the risk of heart attack, and if it's in the brain, strokes. It can be some studies now that shows the bacteria in the mouth are the source of the plaque in the blood vessels with people with atherosclerosis, and can cause narrowing of the arteries. It can also directly go in the blood and cause a local infection in the heart, like the valves. So there are many ways that oral health can negatively impact heart health and many other organs.
Okay, so I'm thinking, you know, for a lot of people, when you floss or you're brushing and your gums are bleeding a little bit, I didn't realize that could obviously affect what's going on in the rest of your body. 100%.
In fact, bleeding gums is not normal. If your gums are bleeding, you either have a really bad floss or if you have gum disease. In fact, about half of adults, about 30 years old and older, these are CDC numbers, and 70% of people over age of 65 have gum disease. 70%.
Gum disease.
Of gum disease. And the #1 sign of gum disease at the early stage, what we call gingivitis, is bleeding gums, right? And just like you said, when your gums are bleeding, you're not really paying attention. You're flossing your teeth, you're brushing your teeth. The microbes, you know, pay attention. They get in the bloodstream. They travel all over the body. You know, if you're pregnant, it can cause significant complication with pregnancy health.
Baby,
not only for you as a mom, as a pregnant mom, but for developing fetus.
I see.
If it goes to the brain, it can cause local infection. There's some studies that potentially is a risk to Alzheimer's, in arthritis, joints, GI tract, you know, heart. So wherever the blood goes, which is everywhere in the body, it can cause a local infection or cause inflammation in the body that can trigger it.
So, doctor, of course, we want to know, what can we do? How do we help our heart?
That's a great idea. So when you're taking care of your mouth, also think that you're taking care of the body, right? You can't have a healthy body without having a healthy mouth. So the way you want to do it is, in the mornings, you want to use the right oral care products. And so you want to, of course, always brush and floss, but use the right products. You want to get oral care products that are safe and at the same time effective. So just as a mom or a dad, myself, we learn about what's in the food and what food we're giving to our kids and we put in our own mouths. We should also learn as parents and as individuals, what's in a toothpaste? What's fluoride? Is it bad or good? It's an alternative to it. What are the other ingredients? Because those ingredients we put in our mouths twice a day. I can't think of any food that would do that, right? So it's really important to know about oral care products, use them, use safe and effective ones, and use them at the right time, and do it the right way.
Okay. Before we go here, how can people get information from you if they don't know what toothpaste? There's so many options.
Yeah, this is an area that you may be surprised even dentists are not very educated, because in dental school we don't learn about what's in a toothpaste. We learn how to do filling. So my book, If Your Mouth Could Talk, it's filled with a lot of information about how oral health can impact your life and how to take care of it the right way.
Perfect. If your mouth could talk. I love that
what would it say?
Right there. Well, we say so many things, but you're teaching us so much more. Thank you for joining us this morning. Great to see you.
Likewise.
And we'll be right back with a quick check of your forecast and, of course, a look at all your headlines. We'll be back.